The Kyleena Intrauterine Device is a small, flexible device that is placed in the womb to prevent pregnancy. It is used by women who want to use a reversible birth control method that works for a long time, up to 5 years. It is also used to treat heavy menstrual bleeding in women who choose to use this birth control method. The device slowly releases a hormone, levonorgestrel, that is similar to a hormone that women normally make. This device and hormone helps prevent pregnancy. It's important to note that using this product does not protect you or your partner against sexually transmitted diseases. Before using the Kyleena Intrauterine Device, be sure to read the patient information leaflet from your pharmacist. This device is placed in your uterus by a healthcare provider during an in-office visit and can stay in place for up to 5 years. It's important to schedule a follow-up visit 4 to 6 weeks after placement to ensure it is still in the proper position. Your doctor may advise using a backup form of birth control for the first 7 days after the device is placed to prevent pregnancy until it has enough time to work. It's also important to check the position of the device after each menstrual period and learn how to do so from the patient information leaflet or your healthcare provider. If the device comes out or you cannot feel the threads, contact your doctor promptly and use a backup form of non-hormonal birth control to prevent pregnancy. If you wish to continue using the Kyleena Intrauterine Device after 5 years, it can be removed and replaced with a new one. Your healthcare provider can also remove the device whenever you want to stop using it as a method of birth control. After placement of the device, you may experience pain, bleeding, or dizziness. Cramps, irregular menstrual periods, and vaginal bleeding between periods, spotting, may occur, especially during the first few weeks of use. You may also experience headache, nausea, breast tenderness, or weight gain. Over time, you may have fewer bleeding days during your menstrual periods, and some women stop having periods altogether. This will not affect your ability to become pregnant after stopping use of this product. Remember, the benefits of using this device outweigh the risk of side effects. Many people using this device do not have serious side effects. However, if you experience stomach/abdominal pain, vomiting, lumps in the breast, mental/mood changes, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, unusual headaches, or symptoms of a serious allergic reaction, seek medical help right away. Using an intrauterine device, IUD, may increase your risk for a rare but serious pelvic infection, pelvic inflammatory disease PID, especially if you have multiple sexual partners or infection with a sexually transmitted disease. If you experience symptoms of PID, such as unexplained fever/chills, lower abdominal/pelvic pain, pain during sexual intercourse, genital sores, or unusual vaginal discharge, tell your doctor right away. If you notice any other effects not listed above, contact your doctor or pharmacist. Before using the Kyleena Intrauterine Device, it's important to discuss any allergies you may have with your doctor or pharmacist. They can also advise you on any inactive ingredients that could cause allergic reactions or other issues. It's essential to inform your doctor or pharmacist about your medical history, especially if you have had recent pregnancy, are currently breastfeeding, have bleeding or blood disorders, high blood pressure, abnormal breast exam, cancer, especially endometrial or breast cancer, depression, diabetes, severe headaches/migraines, heart problems, liver disease, previous pregnancy outside the uterus, stroke, unexplained vaginal bleeding, uterus problems, or conditions that weaken the immune system/ increase the risk of infection. If you or your partner have other sexual partners, this device may not be the best birth control method for you. And if you or your partner get a sexually transmitted disease, contact your doctor right away. It's important to ask your doctor if you should continue to use this device for birth control. Before any surgery or dental procedure, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are going to have an MRI test, make sure to let the testing personnel know that you are using this device, as they may need to adjust the test. It's important to note that the Kyleena Intrauterine Device should not be used during pregnancy, and if you become pregnant or think you may be pregnant, you should tell your doctor right away. Additionally, if you are breastfeeding, consult your doctor before continuing to breastfeed while using this device. It's important to be aware of potential drug interactions with Kyleena Intrauterine Device, as they can affect how your medications work and increase the risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Kyleena Intrauterine Device. If the Kyleena Intrauterine Device is swallowed, it can be harmful. If serious symptoms like passing out or trouble breathing occur, it is important to call 911. Otherwise, contacting a poison control center is necessary. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is essential to seek immediate medical attention in case of ingestion. Make sure to keep up with all of your regular medical and lab appointments. It's important to have regular complete physical exams, which include checking your blood pressure, having a breast exam, a pelvic exam, and getting screened for cervical cancer with a pap smear. Follow your doctor's instructions for examining your breasts, and if you notice any lumps, make sure to report them right away. And if you need more details, just consult your doctor. The Kyleena Intrauterine Device is a form of birth control that is placed in the uterus by a healthcare professional. It releases a hormone called levonorgestrel, which helps prevent pregnancy. Kyleena can prevent pregnancy for up to 5 years. It is more than 99% effective at preventing pregnancy. It does not protect against sexually transmitted infections, STIs. Kyleena can be used whether or not you have had a child. The best time to have it inserted is during your menstrual period. The procedure to insert Kyleena only takes a few minutes and can be done in a healthcare professional's office. Once it is inserted, you do not have to do anything else to prevent pregnancy. Make sure to store Kyleena Intrauterine Device at room temperature before use and keep it out of reach of children and pets. Do not flush the device down the toilet or pour it into a drain unless specifically told to do so. When it expires or is no longer needed, make sure to properly dispose of it by consulting with your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.